I'm Paulette Kerr, Maternity Transformation Project Manager with Surrey Heartlands. I've got my colleague here.
Hi, I'm Amy Stubbs. I'm Deputy Head of Midwifery at the Royal Surrey, and I'm one of the Transformation Lead Midwives for Surrey Heartland.
We've produced a poster about our journey for better births. We've got it here on the wall so you can have a closer look later. We're also handing out some smaller versions of it so you can also have a look and follow through, and you'll get the slides as well. So our vision was quite ambitious to start with. I actually started last May, and when I came into post, the maternity leads were already working on some of the better births work, and they were very instrumental in terms of the bid being put forward and being successful. So we started out by saying that we wanted to have community hubs. Again, this is aligned to the Better Birth Review. We wanted to have a one-stop shop where women could go and access services from various disciplines, and where we could also have our midwifery teams working out of those hubs alongside health visitors, GPs, mental health workers and other stakeholders. We said we also wanted to have a pregnancy advice line, and Amy will talk a little bit more about that, but we wanted to have somewhere where women could actually access clinical advice in a timely fashion, not just antenatally but throughout labour, also postnatally as well, sort of after they've had the baby, where they could get support around information in terms of just, it could be around sort of feeding the baby, other issues that they may come across. So we wanted it for the whole pregnancy pathway. We talked about having a shared IT system. Now we've got 3 provider units, so 3 maternity units across Surrey Heartlands, and we know that in order to have a single midwifery team approach, this is one of the other ambitions that we set out to achieve, we wanted to have an IT system that was seamless, so something that was the same across the 3 providers, and you'll hear a little bit more about that in a minute. We said that we wanted to have a Maternity Voices partnership, but have one approach, so a Surrey Heartlands one. We do have local Maternity Voices partnership, but we wanted to have them more joined up together and have a Surrey Heartlands Maternity Voices chair really driving some of the strategic work around Maternity Voices partnership. We also talked about having a home birth team. We already had one in place, but we wanted to have a Surrey Heartlands home birth team, so again, having a collaborative, joined up approach. Single midwifery team, that was really important, because if we've got the element of choice built into some of the work that we're doing, which is what we set out to do, we wanted to make sure that across the patch that midwives could work with the barriers taken down in terms of some of the glitches that you come across in standalone areas. And then of course continuity of care, which you'll hear a little bit more about later. In terms of the method, how we set about doing this, now it was really key for us to have input from all the provider areas. So we said that we wanted to have midwifery leads who would be seconded to post, working 2 days a week on the Better Births project, and that happened, which has been really key in terms of some of the successes that we've achieved. Also having a project manager in place, that's where I come in, to help drive some of the work and keep momentum going in terms of our milestones. Also key is to have a commissioner assigned to the project. We've got a fantastic commissioner who works for the Women and Children's work stream, and she's also included in the project team, and that's been fantastic in terms of just getting the buy-in. We talked about having a communication lead. When you've got any project, you do need that communication input. And we've actually produced lots of leaflets, and we'll leave some at the back later on in terms of some of the work that we're doing, some of the work streams. But it was really important to have a communication lead helping us in terms of the engagement and how we work with our service users. So we had an engagement plan, a project plan, which it comes without saying really, you need that in terms of the milestones, how you're going to do the work, what you're going to do, measuring some of the risk and mitigating against those as well. So that was really key. The project plan was also to identify who was going to be doing the work, and it wasn't just going to fall on the project manager or the midwifery lead. We've got the heads of midwifery involved, we've got commissioners involved, we've got our public health colleagues involved, so that's fantastic. Some of the assurance process as well was really about sort of how do we make sure that we can send our highlight reports to NHS England, knowing that we were on track in terms of what we set out to achieve and that we've mitigated against any issues. It was really important to make sure that we worked together as a team. So we initially set up a project board, a Better Birth project board, which comprised of the Deputy Head of Midwifery, the Commissioner, myself, we had the public health colleagues, health visitors, and other stakeholders around the table, a GP as well, who would then go back to feed some of the information through to the GP colleagues. But what we quickly realised was that actually we needed a group to do the work in, because often you go to meetings after meetings, but actually we needed to get the work done. So we decided to have a working group, and we meet monthly. In addition to that, we have our assurance process through our LMS boards, reporting to them in terms of what we're doing. Again, building stakeholder relationship, that was really key, not just with those on the ground, our clinicians on the ground and different professionals and those working in different disciplines, but also our service users. We really work very closely with our women and families through the Maternity Voices Partnership. One of the things that we did do as well, sorry, conscious of time, is that we started this Best Birth journey really by launching the actual project, and that was about getting people in the room through the local maternity system who were impacting it to have that conversation. That included our service users. We actually had some babies there as well. We had about 110 people, and it was fantastic. And then we had engagement events as well throughout the localities to make sure we spread the word. A part of that was about also involving our staff and building champions so they could help to progress some of the work that we'd already set out to achieve. One of the key things as well though is we had all this ask, all this ambition, we were very ambitious about it, but how we were going to do it, what was the capacity and demand? And so we decided that we needed to have a Better Birth review, so we commissioned Mari Washbrook to do some work for us in terms of scoping out where we were with our staff and what we actually needed to get some of the work done. And we also did some audits in terms of our baseline. I'm going to hand over to Amy, who's going to talk about our success steps in terms of what we've achieved, and I'll come back and talk about the challenges. Thank you.
Okay, so as Paulette has talked, we had a number of key work streams within our work to enable us to achieve our vision. And I'm just going to give you some highlights, really, try and keep it brief from each one. So, Community Hub pilot. We initially wanted to pilot 4 community hubs across Surrey Heartlands. These were to provide antenatal and postnatal care alongside all the other services that others have talked about when they talk about hubs, but not intrapartum care as they've done in Cheshire and Mersey. So we've had varying success. There has been some challenges along the way with regards to working with NHS estates for sure, but we've launched one community hub. We are currently working on a second site with the County Council, which has been fantastic to engage with them as part of a redevelopment project. There's a third site to launch in March 19. And the fourth, we're still in negotiations around leasing arrangements, and a lot of that has been around financial challenges of moving money around the system. So actually, if there's void space, why are we paying for what we're already paying for? So there has definitely been some challenges and a lot of learning along the way with that. Pregnancy Advice Line, we launched in April this year, 18. I'm going to say 19, but we're not there yet, are we? April 18. We really owe a lot to Hampshire for this, because it actually was very closely modelled on their Labour line, and they were tremendously supportive to us in our initial modelling. But then we were able to work very closely with CCAM, South East Coast Ambulance Service, and launch the Advice Line. It's been a real success story for us. In the first 2 quarters, we took 20,000 calls. We average 130 calls a day. We've reduced our volume of calls to our maternity units by an average of 70%. So that's a huge clinical efficiency really for our midwives. It's also represented tremendous efficiencies and savings for the ambulance service. In those first 2 quarters, we had 70 ambulance downgrades and 91 stand downs by the midwives working with the ambulance service and able to give on the ground frontline clinical advice. So we're really happy with the success. We've only been going 6 months. We were shortlisted for an HSJ award, which was fantastic. So we've been able to share that nationally. On top of that, the user feedback is really positive. The feedback from the staff working on the line and the ambulance service is really positive as well. So we'll continue to grow that, and we're now looking at how we develop that model further and how we can enhance it really. So shared maternity IT system, as Paulette said, that was key to us achieving our vision. One of the big frustrations when we started the project, both for midwives and clinicians working and for women, was that our areas, women that lived in the areas around our acute trusts had a fantastic time and all's well. The women that lived on the boundaries, the crossover areas between the organisations, often had a really bumpy journey, and we wanted to think about how we could make that better. So one of the things was to enable that was the community hubs, but also to have a shared digital maternity record that would enable really good communication between all three providers. So very similar to the bump model, we have managed to procure across all three acute providers the same maternity system, Badgernet, which means that we can now have a completely interoperable record. So it's live in 2 providers and to go live in the 3rd in February, which will mean that all women across Surrey are on the same record, which will be really a great enabler for moving forward really. Maternity Voices partnership, as Paulette said, we had existing Maternity Voices partnerships, but we wanted to strengthen that and we wanted to develop one across Surrey Heartland. So we now have a chair who coordinates the three local chairs. She says Surrey Heartland's Maternity Voices Partnership Chair, and we had a launch in September, which was great. So that gives us that really good link into women across Surrey. Continuity of carer models. When we started as an early adopter, we were very focused on continuity models in the antenatal and postnatal period, and how we could really enhance that and get that to really strengthen that. Obviously, during our journey, the ask altered maybe or shifted a little bit, and it became very clear that we were being asked to deliver intrapartum continuity as well, so we've had to move that, go with that. So we are at the point of launching, well, we have an existing home birth model that delivers continuity to about 6% of our women, and we are building on that and launching various models. They're slightly different in each of our trusts, but the models we are looking at, like many of you, are integrated models with the birth centre. Well, there's a team that's going to be delivering care to women having birth after caesarean section, with a hope really to see improved outcomes and improved choice for those women. We've got vulnerable women. We have a prison population in our area, so we have a team that's bespoke for those women in the prison population, which is very challenging to provide continuity, but as much as we are able to, we're looking at how we deliver improved continuity for them. And that's it, isn't it? And single point of access. So we are hoping to we are launching a platform which will provide standardised information, directory of services really for women across Surrey Heartlands, and signpost them into the individual trust provision. And we're looking at launching that in March. So that's almost there.
Thank you. And just to really give you a quick synopsis in terms of the challenges that we faced, one of them really has been about the scale of change across the geographical footprint, and also the pace of change and having to deliver in a set time frame, and the competing priorities that you have back at base on the ground, trying to get the work done while trying to implement maternity transformation. And one of the massive ones is around the estates, which Amy's already mentioned. But I think it's been fantastic in terms of just trying to work with our local Borough Council colleagues just to get some of the work done. And then we've also got the clinical and operational challenges. So during this project so far, we've had staff changes. So one of the maternity units, the head of midwifery left, and also the deputy head of midwifery left. Now that wasn't envisaged when we started the programme, and so we then had to revisit how we actually put support in to that area and support the staff to get the work done. So that was sort of that's just some of the challenges we faced. In terms of the tips going forward, top tips, we just sort of made a few here. The key really is around clear communication, and that's not just for your staff but also your service users, the women and families who are really at the heart of what we provide. Making sure that you've scoped out your resources, and of course finances is always an important one. There's something about having partnership work, but also making sure you've signed on the dotted line and having your memorandums of agreement and understanding, because when you're working across providers, it's easy to sort of say, yes, okay, we've got the buy-in, but actually when you sort of hold people to account in terms of something that's written, it really just makes a difference. Monitoring your milestones, again, looking at your risks, and also invest in your workforce. Now, one of the things that we did when we first started, I remember when I worked with the team, we sat down and we just created a workforce leaflet for our staff, so we could go out and just say, actually, this is what Better Birth's about, this is how you can access us, this is how you can be involved. And I remember sitting down with the midwifery leads, and we created a Wordle baby. We can send this around. Because we thought actually, and if I read some of the things that's here, it's about continuity, it's about support, it's about personalisation, it's about giving them confidence, it's about choice, relationship, and making sure that the care that we provide is accessible. In terms of the next steps, we really want to make sure that we can embed some of the good work that we've done on our Better Births programme. So we've got a maternity transformation conference that we're launching and having in January next year, and that's really about getting everyone around the table to say, actually, this is what we've done, these are the learnings, how can we embed it going forward so it becomes core business going forward as well. We've actually recruited to a learning disabilities midwife, and we want to make sure that she can work with some of the cohorts in that group and just support some of the easy materials. I know that NHS England have got some change material tools, and we want to make sure we can sort of use that and again build some continuity as well. We've done some case studies, we want to do some more, we want to have toolkits, because we get asked a lot, particularly about the Pregnancy Advice Line, how did you do it? So we're creating a toolkit around that, and then I'm drawing together an evaluation report as well for the project. And just to end by saying that there's a statement that says, only look back to see how far you've come, and actually looking back today we recognise how far we've come. Thank you.